Welcome to Capital Connections. Capital is one of the UK's first people-led mental health organisations. For over 28 years, we have brought together people with services and professionals to improve support, influence design and deliver training shaped by real experience. We are an independent peer-led charity with more than 300 members. Our work is led by people with lived experience through shared learning, workshops, training, community spaces and independent forums. From leading peer-led services to establishing an independent lived experience advisory group for West Sussex, to gathering the voices of people affected by addiction through the West Sussex Drug and Alcohol Partnership, our role is consistent, ensuring lived experience informs decisions at every level. This podcast explores health and well-being in Sussex through real stories, insight and reflection. Giving space to lived experience voices is Capital Connections.
On today's podcast, Duncan talks to Tim Fooks, High Sheriff of West Sussex. Tim's a retired GP whose focus is on access to services, stigma and men's mental health. We really hope you enjoy the podcast.
Could you just introduce yourself and your role?
Thanks. I am the current High Sheriff of West Sussex. This is a royal appointment. One is nominated to do it by people from the county. It's a role which involves upholding, supporting those elements of our society which are to do with justice, but also the voluntary sector emergency services. I summarise it as those people who protect, care and service in our communities. It's a role you carry out for a single year. It's an extremely ancient role and has developed over the centuries, but now is largely ceremonial. My career has been in general practice in West Sussex. I was a GP in Pulborough for over 30 years, now retired, with a particular interest in children's and young people's health, but also mental health. And I chose to have mental health, and particularly the three themes of access to services, stigma, and men's mental health as the core of my themes, my interest during my single year of being High Sheriff.
Thanks, Tim. Welcome to the podcast here. So you've been running a series of events in West Sussex, I guess one could call them road shows, maybe, I guess, focusing on mental health and wellbeing, as you said. What was the intention behind hosting those events?
The intention was quite simply to create a locally focused conversation and perhaps debate about mental health services as they relate to each of the communities of West Sussex. The communities are defined most easily by sort of boroughs and districts, but those actually are aligned to the neighbourhood areas or footprints which mental health services, NHS services use to define how they deliver their services. So it seemed sensible to have a locality focus. But what I wanted to do was to ensure that every element of the mental health community was involved in each of these discussions. And so for my first sort of 6 months of my tenure as High Sheriff, I've worked with every agency I can possibly get to, from commissioners through to providers, through to community-based peer-to-peer support groups, individuals with a lived experience, so that when we actually had a discussion, every element of the mental health community would be able to be represented. And I'm very conscious of the fact that people's experience of mental health services from a patient point of view is often one of fragmentation, one of barrier. And I wanted to create at least a place where those sorts of barriers and that sort of fragmentation didn't exist. And, I think as much as I can possibly hope for, with 7 conferences happening, so one in each locality, over 400 people attending, I would say that, and I'm told that it's been a unique opportunity to have a discussion about mental health in West Sussex because of all those elements that I've just talked about.
And as someone who came along to 2 of the events, I can sort of concur that it was led by, all of the events were sort of co-produced, as we'd say, led by people in the room, and themes that were brought up by people, who were there able to bring up things that are important to talk about to them in their community. So, what sort of themes do you think emerged from the events?
Yeah, I just want to concur with that. That the design of the conferences obviously was there to give some information. They were fortuitously timed so that they linked to the launch of the new mental health neighborhood mental health teams that the NHS has created, but also the new Pathfinder contract that's been launched as well for the voluntary sector services. And so there was an element, obviously, of the conferences giving information to each of the communities in those areas, each of those localities. And also, I wanted to ensure that my role as High Sheriff was respected by bringing into the conversation the people who often are not involved, and that's the police and emergency services who have to still deal with a huge and very significant element of mental health, whether it be affecting the trauma that staff experience when they're dealing with difficult experiences, not necessarily related to mental health, but can affect their mental health. And more specifically, the police who have to have this involvement in crises of mental health, which involves them sometimes, sadly, quite frequently, having to put in place a Section 136. And I felt it was very important to use these conferences to give information to these rather difficult bits of information to tap into. But the second half of the conference was given over to the delegates to decide what they wanted to discuss. So over 31 different topics were identified as being those that individuals or groups wanted to discuss. I know it's 31 because I've just written up the report, and I can concur that I have 31 different elements to report on. Now, for some of those, it was an opportunity, perhaps a unique opportunity again, for people to come and do a deep dive into these new services that were being created by the NHS to really understand how they or their organisation can interact with it, how they can influence it, how they can communicate about it. But for others, it's more, perhaps some of them is more personal. I can really, wherever I go, I can sort of, in my mind, I can think of things which were led by people who had very specific experience. People talking about the stigma of having a mental health diagnosis and a journey with mental health. People discussing travellers, rurality, the LGBT journey, experiences of those who are unpaid carers. You could see that these are, each of them, incredibly important elements. You wouldn't want to have a conversation about mental health without them being discussed, but they are just a fraction of the discussions topics that came up. It was extremely rich and really valuable because the people there knew what they were talking about. And that's my only disappointment was I couldn't get around more of the tables personally, but each table I went to was a very significant place.
And what do you think that these events might have achieved for communities?
Well, I'm a great believer in conversation. I'm a great believer in communication for communication's sake. If one only has discussions when there's a crisis that needs to be resolved, you don't have a basis of relationship in order to be able to develop that issue and to focus on the solution. So developing communication channels, increasing understanding. That's the most important thing, really. I mean, in all my work with patients, just on a one-to-one basis, understanding of the journey that they're on has always been at the core of what I have felt was my role as a GP to achieve with them. Obviously that some of those decisions that result from that are extremely challenging, sometimes give a great reassurance, but understanding's at the core of it. And I'm afraid you can't assume that people just understand that what you're communicating, that what you're communicating is understood. You can't make that assumption. So these conferences gave people the opportunity to give information to the people who mattered and hear whether it made sense, and then dissect out the things that they wanted to dissect out and understand better. And for other people, it's just actually a case of being able to be heard by those that understand as well. And just for someone to be able to talk about their journey with deafness, for example, and to understand what to be deaf is from a mental health perspective, and to have an interpreter there too who could actually ensure that they could engage fully in the conversation that was going on. That's really powerful. It's a sign of respect. It's a sign of engagement. It's a sign of what I believe the NHS should be about, which is focused about patient journeys, even though, of course, it has to also deal with process. But, essentially, process should follow the patient's journey rather than the other way around. But unfortunately, as we all know, when you're running a huge organization, a huge ship, it's very difficult to achieve that. So in my experience, everybody who's been involved in it from a sort of statutory health basis has really welcomed the opportunity to have this, because they just don't have this chance to talk in this way, because it just doesn't come round in the way in which they are structured to work. So it's been very constructive for everybody, I think.
One of the things you said when I was at one of the events was that you reflected on your experience in your role as a GP, and you said that actually you wish you were a GP now, given what you've been listening to during some of those events. So just wondered what you meant by that.
The top and bottom of it is that complex conditions create complex management plans. Things, when they come down to mental health, are never straightforward. It's not a linear experience having a mental health journey. It's certainly not a linear experience trying to support someone with a mental health journey. And the complexity and the need to try and find the right place for a patient to take their problem, to have the right support for them to be able to learn how to deal and cope with their problem, is extremely difficult. And in the system that I worked with, the NHS was set up in such a way that when you referred someone into an element of the mental health service, if it wasn't the correct fit, they had to reverse out, come back to you, and then you had to start all over again. They would have to keep on repeating their journey, their story to a new person, without, and perhaps with increasingly less confidence that their problem was finally going to be sorted out. The journey could take months and years to find. And the new design for the service is designed to meet that problem. What we were told is that patients would be referred into the service. Their case would be reviewed. If they were unsuccessful with the type of support that they were given, they wouldn't be discharged. They would be held an opportunity for the GP to come into a hub to discuss with the providers what might be the better route. So the patient would then have a journey internal to within the system, rather than having to come external to it and go back in again. That to me sounds like a game changer for my patients' journeys, and I wish I had been able to work in that environment if that had been the case. 25% of my consultations were for mental health issues, but actually, mental health is an element of every physical health journey as well. You can't really divide the two out. And I found that this concept, if they're able to resource it as well as they hope, if it's able to be delivered without the waiting times being too long, I think it should be a vastly better journey for patients. But don't get me wrong, I know that our mental health colleagues working within the NHS are inundated with work. I think it's a very, very challenging place to work, and I have huge respect for what they try and achieve. But I do think the system that they were working in before didn't help them either, and it certainly didn't help the patients. And I would like to have experienced that with my patients, that particular new service.
So lots of conversations, lots of people have come and given their ideas and suggestions and comments about mental health and wellbeing services in West Sussex. What do you think needs to happen next to build on the momentum of the events?
So what I've done is I've now written up the report, which has taken all the notes that the delegates wrote up very kindly for me. I've compiled it into a report. It's currently sitting with my friends at Public Health just to have a review of it. I want to make sure that the document is seen to be a constructive and positive resource for every element, and I want to make sure it's accurate, and I want to make sure that there's therefore people can read it with confidence. So I am going to be doing that due diligence with the document. I'll be sending it round to the group of about a dozen people that very kindly helped me set up were my discussion group for setting up the conferences. And after that's done, I will be sending it out to every single delegate, along with all the details which people are given permission to share about their contact details. There are actions that have been identified. There are actions already that have been taken. And in a sense, there's an element of both it being a resource and also a challenge, to people. This now has been, I think, proven to be a validated process. Everybody from the mental health community has been there. Some extremely important suggestions have been made. The challenge to all of us who are working in a professional capacity is to make sure that we take into account those sorts of comments when we're doing our co-production, redesigns, new initiatives, all those sorts of things that people are doing. It at the very least, it should give people now a chance to get information about topics perhaps they hadn't thought about before. If you haven't had a chance to think about travellers and mental health from the perspective of the travellers community, well, there's a chance now for you to actually get your head around that a bit and to understand there is an accessible document which you'll be able to do that with. So to a certain extent, the document, as I say, is an invitation to people to participate in a new level of discussion. Whether people would choose to do that or not, ultimately will come down to what they feel they can do and achieve. But I would hope very much that, and I believe I've already heard and seen experiences of people who are doing things differently because of the conference and the discussion that they've had.
It's certainly a rare opportunity for people to come together in the way that people had done, and there is never really a space for that. The people don't have the resource or the time to connect. So I guess we thank you for bringing us together, bringing the services and people, communities of West Sussex together, for that process to take place. So we thank you for doing that. Just a question about lived experience, really. Just thinking about how you think lived experience is influencing decision making here for mental health services, or indeed wellbeing services generally.
I'm certainly aware of the work that you've been doing and over some years, and I certainly was extremely grateful for your Capital's involvement. I think you had at every conference you had one of your members there, and it was very important to me. I should say that when I was a GP, I encouraged participation by patients as critical friends in my practice. We were twice rated as outstanding by CQC, and I believe that the involvement I had from patients in our practices development was central to that. So I absolutely believe that without lived experience, feedback and engagement in every service, not just mental health, you can't possibly design a service that's going to actually fit the bill accurately. So in every element, I think there should be a proactive process to ensure lived experience. Those with lived experience are heard and have a chance to give impactful feedback. And I think there are by doing this conference, there are many groups who had an opportunity to actually get involved in feeding back in a way that they hadn't actually had before. And that was great to see. So I was particularly moved by the conversations regarding the ethnic minority table at Crawley, where they still identified very significant difficulties in accessing certain aspects of mental health services. And the concern they had that sometimes NHS surveys were done, people would come down, take time to come and fill out feedback forms with them, and then nothing would actually seem to come of it. You don't have to be a medic or to be involved in strategic health service to know that isn't an effective system. So ultimately, the proof of whether lived experience is having an impact will be that those with lived experience will tell you that it is. And that is the challenge for those that have got the responsibility of designing services. And I genuinely believe, having had conversations with commissioners and others, that that is absolutely their intent. I have no doubt about that. And sometimes I think that the way the conversation goes and how the conversation is done, sometimes it's an element of both sides having to work out how to do that more effectively. I think it's not just the responsibility of the providers and the service creators. I think it's the service users also have to be sometimes smart about how they do that interaction. That's something which is therefore a challenge for both. But I know it's absolutely essential and central to a good service being developed.
And I guess by having the events themselves is a way of bringing people together to really, and hope that sustains, really bringing local groups and organisations, local people, different organisations that haven't been part or haven't been known how to take part in discussions about planning for the future with commissioners, etc. So I guess it's really needed in terms of forcing those conversations and making sure that people come together to co-produce things and design local services together.
Absolutely, and as I said earlier, the problem is if you only ever come together because you're having to go through a report because of some disaster. It's not. It obviously has to be done, and these inquiries that have to come up from time to time because of catastrophe, they have to be done, and they're very important, and a lot can be learnt from these significant events. But actually, sometimes you need to do significant events about things that have gone really well, and actually to share why a journey was so good for someone, and to understand what element, because actually there's just as much that's had to go right as in bad things has had to go wrong, and we don't do that because we haven't got time and all those sorts of things. I recognise all of that because I did a lot of work on strategic health for children and young people's medicine, and understand about a lot of the conundrums that face the other side as well. And obviously, I've been a patient with my own experiences, not necessarily mental health one, but I've had to have my own patient journeys through the NHS. So I understand what it is to be some elements of what it is to be sort of kind of in the dark a bit about what's going on. But I think these sorts of opportunities to have just conversations where there isn't a specific issue that we have to resolve because it's gone badly wrong, to be proactive, therefore, to maintain a conversation, is probably what I would most hope that comes out of these conferences, that people say this is actually something almost we can't do without. And I love the way how the open space technique, which we use to enable people to actually bring on the day the things that were important to them, just to show how valuable that can be, and how you don't have to organize every element of these things to have a good conversation. You can, frankly, trust people when they come together in this context to use the time effectively, and they certainly did. I don't think there was a single moment anybody would feel there was a single moment wasted on any of those 7 conferences.
So what practical change would you like to see over the next 12 months that would make the biggest difference?
One of the most important things is that the way in which the new mental health services and the new structure is communicated with patients and with sort of intermediary people such as GPs, I think that needs to be really carefully thought through. I think there's probably quite a lot of investment needed to actually ensure that the communication is absolutely as good as it can be, because I think otherwise, I'm afraid, you could do the best in the world and people don't know about it, then I'm afraid it's never going to deliver what you hope for. And I think maintaining the involvement of our civic colleagues in that is very important, because I think what I've also learned is that those working within the local government situation, obviously there are changes coming with that, but there's no reason for this particular comment to change, is that they are the great experts at communicating with local people. They have many different ways in which they can do it, and they need to be seen as partners in this opportunity to improve the mental health and well-being of their population. So ensuring that everybody is aware about how to access mental health services in these new mental health services, so that the threshold that people have to go through in order to take that step to go from I can't cope to I can get some help and I know how to do that is made really, really clear. I also think that we need to recognise increasingly the power of peer-to-peer support. That where peer-to-peer support organisations are available, are well led, are well resourced with training, that ability to hold people in a productive, safe, enhancing, life-enhancing place with the difficulties that they have and are not going to get rid of, because, you know, as we know, many people's difficulties with both physical and mental health is not something that can be cured. It's something that you have to journey with through your life, and often it can make you a superpower, and sometimes it doesn't. But to be with others who understand that inherently is incredibly powerful, and I have really appreciated and valued the time I've spent with the peer-to-peer support groups.
Just wrapping up, and just my last question is around your role. Actually, just thinking about what surprised you so far in your role. What's been the biggest surprise for you? You might not have had any, actually.
We didn't mention it, but I'm very unusual in that this is the second year that I've done the role for. So normally it's a single year. I was the first medical high sheriff for Sussex in its history, but also the first person to do it twice since 1551. And the reason for doing it twice is because my first year was in the pandemic. And during the pandemic, I did a lot of work on loneliness and brought people together for that. So in a sense, this particular year has not been a surprise to me in the sense of understanding how much there is going on in our county from a community point of view to support others, a commitment to definitely ensure that those who are at risk do get support. But there's always has been a problem about how often I've come across people doing similar work without knowing that someone is doing something similar around the corner. And that sense of disconnect between those that are working and serving and taking care of each other has still surprised me somewhat. But I can understand why that is, because they're so focused on what they're doing that sometimes, you know, they just have to sort of keep on at the coalface of what they're doing to make a difference to people's lives, and they don't really have time to get out and see what is happening. But actually, when they do communicate and when they do realize that they could share resources or learn from each other's experiences, I think they could end up being and do become stronger as a result. So I suppose I'm still slightly surprised by how much need there is to ensure that people do maintain live and updated networks when they're doing similar things. And basically, you know, I think you can't assume that people know what's going on. So that's the thing that surprised me. What I've not been surprised about is how much good is going on, how much is actually happening within the voluntary sector, how much the people who are working within the statutory services, whether it's be the emergency services, police, the justice system, how little cynicism I've come across and how much energy and commitment I've seen from people trying to do their level best. The systems often don't help them to do that, but I can't think of a circumstance where I've come across somewhere where I felt, you know, maybe they were in the wrong job. You know, people are trying their level best to do the best for the people that they have responsibility for, and sometimes it's jolly difficult. But you know, the heroes for me perhaps are the people who are working on the ground, using their own experiences, using their own resources, and making a big difference to the group of people around them. And it's extremely humbling and has made the year very special for me.
Dr. Tim Fooks, High Sheriff of West Sussex, thank you very much for your time today.
Thank you.
You've been listening to Capital Connections. Capital is an independent peer-led charity working across Sussex to amplify lived experience, strengthen peer support, and influence how services are designed and delivered. If this conversation resonated with you, you can share this episode, follow or subscribe to the podcast, visit our website to learn more about our work, or get involved in future conversations. We're always looking to hear from people with lived experience, people committed to co-production, and others who want to do things differently. Connection starts with voice, and voice leads to change. Thank you for listening.